Tomorrow. Here to face off on the fast-moving, the latest plans for health care reform, Mo Elleithee, Democratic strategist and former campaign spokesperson for Senator Hillary Clinton, and Matt Mackowiak is a Republican strategist. Matt, as we look at the Senate floor right now, and they've started debate, and there's Senator Cornyn speaking in defense of these restrictions on abortion, the key action seems to be off the Senate floor, where these progressive and centrist Democrats appear to be very close to a deal whereby Americans would have, a certain number of Americans would have the same access to health care insurance plans as members of Congress. Why is that something Republicans can't support?
Well, I think first, David, it's clear that the public option appears dead. There's been questions about that for really a period of weeks, but it appears clear now. Democrats are admitting the public option's dead. The question you have to ask is the federal government still going to provide massive subsidies to set up this co-op or this nonprofit plan that's similar to what members of Congress have today? At the end of the day, if the federal government is funding it, in terms of setting it up, they're going to have a lot to say about what's allowed and what's not allowed. So the question is this a system that's going to remain private in the private market, or is it going to be a government-backed system where the federal government has control over it? And that's the real question.
Matt, we're looking at live pictures now, but you pointed out if the federal government would be able to determine. We know, again, that insurance companies do that right now, and I don't think you directly answered David's question about why then people have been saying for some time, why can't I have the same coverage as those men and women we're watching right now decide our health care future?
You're asking why is that
a bad idea? David's question was why are the Republicans, or how can the Republicans be against something that seems very basic in understanding here?
Well, Tamron, look, I think Republicans would prefer keeping things in the private market and removing barriers to purchase insurance in the private market across state lines. That would introduce private market competition and not fundamentally change our healthcare system that provides the finest level of care, among the finest level of care in the world. So at the end of the day, the question again, as I said before, is the federal government going to have to spend massive amounts of money to set up this co-op-based system? If they are, then the federal government's going to say what types of treatments you can have and can't have. So that's the fundamental question, is how do you fund this co-op?
Mo, your view.
Well, I agree with Matt. We do have the finest level of health care in the world. The problem is a lot of people can't access it, and a lot of people can't afford it. And leaving it completely in the hands of the insurance companies is why we haven't had so many people able to access it or afford it. I think this is a common sense plan. It's not going to make everyone on my side of the aisle happy. There are going to be a lot of people out there that are still angling for a pure public option that aren't necessarily going to love this. But if they're looking for the fundamental, which is a plan that is fair, that is affordable, that is going to increase access and help average people, then this plan would get us there. I think, Tamron, your point is well taken. This is something a lot of people have been clamoring for. They look at this and say, if it's good enough for Congress, why can't it be good enough for me? That's why I think this plan has some real potential, and we're already seeing some of the moderate Democrats who have had some concerns and some holdups and some hesitations beginning to come around on this. So I think we're getting closer.
And Matt, as far as the other issue, it looks like part of the deal might also be lowering the Medicare age from 65 to 55. Would Republicans oppose that as well?
David, I'm not sure how they would respond to that specific notion. I mean, that will add tremendous cost to the overall cost of the plan. And keep in mind, Medicare is broke. I mean, Democrats have tried to propose, Medicare for all. I believe it's $29 trillion in unfunded liabilities for Medicare looking out into the future. So to expand Medicare now to a larger group of people is only going to increase cost. And so I think at the end of the day, you have to look at the fundamental problems that still face this health care plan in the Senate. Number one, that is abortion. You need 60 votes to change the bill in its current form. This Ben Nelson sort of Stupak type language appears not to have 60 votes. So you're going to lose Ben Nelson. You might lose Bob Casey of Pennsylvania. So they're going to have to go after Olympia Snowe, which is why moderate Republican Olympia Snowe, I think that's how they're going to try to get to 60. But again, you have questions about the overall cost of the bill and whether it's going to bring premiums down. Is this going to indeed be affordable for the American people? I think there's very serious questions about that right now. And to expand Medicare and increase cost when we can't afford Medicare the way it is right now, I think is foolish.
Mo, and let's switch topics, Mo, real quick to the Sunday talk shows with Afghanistan. It seemed that a lot of those within the president's inner circle were trying to clarify whether it's the beginning of a withdrawal in 2011 July or if that means it's an exit strategist. Mo, what's happening here? The big question on Politico was, is it the generals or the president that is controlling what's happening there?
Well, look, I think the president was smart to put in a timeline and an exit strategy. I think that's the fundamental difference between this administration and the previous administration is we are putting pressure on the Afghani government to actually get its act together by letting them know
but what do you
that we're going to start moving out.
It seemed that the cleanup job or the spin that we were seeing from some of the leadership over the weekend.
Look, again, I think that it is a strategy that they're putting in place to make it clear to the Afghan government we are not going to be there forever. We do have a strategy to get out there. There is a timetable for when we get out of there, and so you need to take responsibility. As to the question about who's in charge, it's the president. He's the commander-in-chief. He is taking advice from his military advisors, and rightfully so, but ultimately it is his policy.
Mo Elleithee and Matt Mackowiak, thank you both for coming on today. Great stuff as always.
Thank you.